Welcome, everyone. We'll be starting in just a couple minutes. And if you'd like, you can introduce yourself in the chat and your name and if you have a nursing specialty and where you're calling in from. All right, welcome everyone. For those that just joined, if you want to pop your name, where you're calling in from, and any professional pieces that you want to put in, like where you're practicing or what your specialty is. We'd love to know more about who's joining us today. And we are going to get started here. I'm so glad to see all of you here with us today. I'm Katie Huffling. I'm the Executive Director for the Alliance of Nurses for Healthy Environments, and I'll be moderating today's call. And I'm just going to share my screen here. I've got just a couple introductory slides. Let's see. And let's see, is it showing the full screen or is it doing the, it was working weird for me earlier.
It's great.
Okay, thanks, Robin. Yeah, so this is number 5 in our Nurses Drawdown webinar series, which is really exciting. We've had such great feedback from folks around the world. And as a nurse midwife, I'm really excited that we're going to be talking about gender equity. It is a topic near and dear to my heart. And we have 3 great speakers today that I think we're all going to be able to learn a lot from, but also I hope will inspire us to different ways that nurses and other health professionals can become engaged on this topic. We have Christina Kwok, and I just realized I have misspelled your first name on the slide. Sorry about that. We have Monday Limbu and Kate Lane, and I will be introducing all of them before their presentations. If all of you, if you have questions, if you can put them in the chat, and we'll be doing questions at the end. And then also, we have 1 hour of free continuing education credits for folks that are joining us today. And we will be sending out a post-test and evaluation. Usually it takes a couple days for that to get out. And so in order to receive that 1 hour of free CE, you need to fill out that post-test and evaluation. So I just wanted to ground us on what is Nurses Drawdown. We have been around for almost a year now, which I can't believe it's gone by so quickly. And this is a collaboration between my organization, the Alliance of Nurses for Healthy Environments, and Project Drawdown. And we had this amazing group of nurse leaders and climate change experts that came together over about a 6 to 8 month period where we looked at all the different pieces of Project Drawdown and all of their recommendations on how we can most quickly and most successfully draw down carbon out of the atmosphere. And we picked 5 key areas of action that we felt would resonate with nurses and had really clear health connections. And so those 5 key areas that we identified We're food, which is supporting a more plant-based diet, decreasing food waste, and clean cook stoves. Mobility, which is supporting walkable cities, access to mass transit. Nature, which is planting trees and supporting reforestation. Energy, which is looking at renewable energy sources and energy efficiency. And then gender equity, which is access to family planning and educating girls. And we have actually now over 16 supporting organizations from around the country or around the world, and close to 800 nurses have signed up with Nurses Drawdown. And so just to ground us today on why nurses should address gender equity, we know that educating girls boosts economies, lower rates of unintended pregnancy, and allows them to have more active roles in their communities. Educated girls realize higher wages and greater upward mobility and contribute to economic growth. The rates of maternal mortality drop, as do mortality rates for their babies. And education, which I think this is amazing, also improves resilience so that families are more equipped to face the challenges of climate change, such as extreme weather events. And then for family planning, access to voluntary, high-quality family planning empowers women. It lowers maternal and infant mortality rates and reduces poverty. And it has the added side effects of benefits to the planet. And one thing that I love on the Project Drawdown website, they have this great quote. It says, "It is critical that human rights are always centered, that gender equality is the aim, and that benefits to the planet are understood as positive ripple effects of access and agency." And then these are just a few recommendations from our website on things that nurses can do to address gender equity, to draw down carbon. Providing menstrual products to women and girls in developing countries can help provide them with consistent access to schooling, because that can be a problem with them being able to go to school if they don't have access to those products. Involving men in family planning, because for far too long, contraception has been responsibility placed mostly on women. And so making this more of a group effort for both partners, I think it can be really empowering both for women and men. And then involving trusted faith organizations and religious leaders. And nurse partnerships with these leaders can help provide a safe place for community members to learn about family planning from both a healthcare provider and a community leader. So these are just a few of our suggestions, and we'll be hearing much more today. And again, I hope that you'll be inspired to continue to take these actions and expand the work that you're doing around gender equity. And with that, I'm going to turn it over to Christina. And as she gets her slides up and I stop sharing my screen, let's see. Come here. There we go. So Christina Kwok is a non-resident fellow in the Center for Universal Education at Brookings Institute, and is a 36 by 36 transformation fellow with the Wellbeing Economy Alliance, the Schumacher Institute, and the Collective Leadership Institute. Christina is a social scientist with a current interdisciplinary focus on education for climate action. She is an expert on girls' education in developing countries, 21st century skills and youth empowerment, sport for development, and the intersections of gender, education, and climate change. She's a co-author with Jean Sperling and Rebecca Winthrop of What Works in Girls' Education, Evidence for the World's Best Investment, and has published numerous policy papers and academic articles on topics in climate change, education, gender, health, and international development in education. Previously, Christina led the Akinda Global Scholars Program at Brookings, a visiting fellowship aimed at building the evidence in girls' education while building the research capacity, leadership, and professional networks of girls' education leaders. She holds a PhD in comparative international development education from the University of Minnesota, soon to be my alma mater as well. an MA in social sciences from the University of Chicago, and a BS in psychology from Sewanee, the University of the South. Welcome, Christina.
Thanks so much, Katie. I'm really delighted to be speaking with you all today. It's my first time talking to a group of nurses and those who are practicing in the healthcare profession. It's really exciting for me because I think one of the points that I make in my presentation is really around the need to consider healthcare professions as a green job. And I think you'll see why I think that later. Okay, so I'll launch into this quick presentation. So it's really focused on kind of conveying the importance of education for climate action, and particularly paying specific attention to the importance of girls' education in low and middle income countries, and how sort of the lessons learned from girls' education can lead us to what I call a new green learning agenda that's rooted in principles of gender equality and climate justice. So let me get going with this. So first, we have to understand that while climate change may not discriminate when it comes to wreaking its havoc on the planet, its impacts are most acutely felt by the most vulnerable and the least skilled members of society, who often did very little to contribute to present day emissions in the first place. In many low and middle income countries, many of which also happen to be some of the most climate vulnerable countries, when we talk about the most vulnerable and least skilled members of society, this most often means we're talking about girls and women. And so why is this? So for starters, strict and constraining gender norms often leave girls and women less exposed to life-saving information, resources, and skills, because they're often excluded from public spaces and from participating in household and community decision-making, as well as participating in risk reduction activities. And as a result, women have a lower life expectancy in the face of natural disasters. And in some cases, women and girls can make up to as much as 90% of those killed in weather-related disasters. And then those who survive are highly vulnerable to human trafficking and sexual assault during post-disaster recovery, oftentimes in crowded shelters or in temporary camps. And then on top of that, in both prolonged and short-term weather-related crises, household coping mechanisms also put girls at higher risk of school withdrawal in order for girls to have more time to help complete household responsibilities like fetching water in times of drought, or even forced early marriage because their dowries, for example, can help to ease the burden of stretching scarce household resources across multiple family members. So such responses threaten to change the course of girls' futures, perpetuating their marginalization and thus their vulnerabilities in ways that will have long-lasting impact on themselves and future generations. So in the context of climate change, girls' access to education is, often collateral damage. Calculations by the Malala Fund suggest that by 2025, climate change will prevent at least 12.5 million girls from completing school each year, and that this will exacerbate existing challenges to girls' education for 280 million girls living in climate vulnerable countries in sub-Saharan Africa and in Central, South, and Southeast Asia. So consider all of this, the damaging effects of climate change and how they hit girls and women in low and middle income countries in the global South particularly hard. We have to also consider the flip side, how educating girls and women can be a powerful part of the solution. So research in girls' education has generated a long list of reasons why investing in girls' education is a good idea, not only for girls themselves, but also for their families, communities, countries, and even the achievement of the UN Sustainable Development Goals. And as Katie mentioned some of these earlier. So these reasons, or what we call sort of co-benefits, include a long list of things: increased economic empowerment, reductions in early and forced child marriage and early childbearing, increased agency, increased agricultural productivity, and the list of positive ripple effects goes on. But what research has just begun to key into is that girls' education may also be a formidable mechanism for mitigating against and adapting to the impacts of climate change. So for instance, when girls and women are better educated and included in decision-making at all levels, their families and communities are more resilient to and capable of adapting to economic and environmental shocks and are better able to plan for, cope with, and rebound from climate crises, as Katie mentioned earlier. Data even suggests that there is a strong positive association between the average amount of schooling a girl receives in her country and her country's national scores on indices that measure vulnerability to climate-related disasters. So this is a very important and significant sort of component to pay attention to. So within this context setting, I'll turn to outline 3 specific ways that research suggests an investment in girls' education can contribute to climate strategies by tackling those underlying inequalities that increase girls and women's vulnerabilities to climate change, and also help, drive some of those root drivers of the climate crisis. So the first platform, and for those of you who might not be familiar with the UN Sustainable Development Goals, I've included the sort of the icons of the goals that these platforms also address. So this first platform is focused on increasing girls' access to quality, transformative, and empowering education, including comprehensive sexuality and reproductive health education. So this platform is grounded on the evidence that levels of female education, or the total years of schooling, is a strong predictor of age at marriage and the onset of childbearing, as well as a predictor of average family size. While this effect greatly depends on context, on average, in countries with low overall levels of education attainment by women, and also high rates of early and forced child marriage, as well as a high unmet need for family planning, a quality education that includes attention to issues of gender and power can be an effective pathway to empowering girls with control over their own bodies and their reproductive lives. So in average terms, this means that a woman could have 3 fewer children in her lifetime, thus enabling her to spend her finite resources on fewer children and to dedicate more of her own lifetime to achieving her potential, her full potential in society. So this is obviously, I think, something that you all are very familiar with, as girls' education together with family planning has been highlighted by Project Drawdown as one of the most powerful climate solutions in terms of its potential to address an underlying driver of climate vulnerability and to avoid 85 gigatons of additional carbon dioxide between now and 2050. In Drawdown's current modeling, health and education is outranked by only one solution, which is tackling food waste. So this platform of girls' education is premised on the assumption that increasing the years of schooling for girls helps to delay the first age of birth, increase spacing between births, and decrease infant and child mortality. The relationship between education and fertility has been made popular by both the climate science community as well as the population health and environment community. And it's really helped to bring greater visibility to girls' education as a viable climate strategy alongside more technical solutions. But I cannot, continue this conversation without also pointing out some caveats to this platform, and in particular to its outsized emphasis on the impact of years of schooling on fertility rates, as well as a narrow focus on a single relationship between population dynamics and carbon emissions, and that's mainly the number of people on the planet. So, and I'll explain some of these caveats. So first, while population and climate change are inextricably interlinked, this relationship isn't just influenced by the sheer number of emitters, but also by how we're emitting. So our patterns of emissions. So for example, in the US, where our fertility rates are lower and educational levels for both girls and boys are higher than in many countries in the global South, our historical and contemporary emissions are also much higher and have a greater impact on climate change today. So if we don't address the underlying behaviors of high consumption mindsets and lifestyles, a smaller but more educated population tomorrow will not give us the intended emissions reduction outcomes promised by this pathway. So we also have to recognize that investing in girls' education and family planning for the purposes of reducing girls' and women's fertility is an ethically dicey approach, as it focuses on girls and women in the global South and can easily be co-opted by racist agendas to control Black and brown women's reproductive decisions. There's a long history of forced and coerced sterilization efforts of Black and brown women throughout the global North and the global South, and a focus on number of emitters can erase this racist history of eugenics. So we need to consider that. Second, fertility cannot be and is not the only mechanism through which girls' education is a solution to climate change. And in fact, research shows us that the relationship between education and fertility is a bit more complicated, influenced by a number of factors, including access to family planning, as well as girls' and women's control over the reproductive choices, whether or not there is equal decision-making power in an intimate partner relationship, and so on. Katie mentioned, involving men, for example, in family planning. So simply staying in school longer doesn't guarantee reduced fertility, but unfortunately, this is often the key assumption in models that are focused on education's impact on fertility, and we have to keep that in mind. And then finally, an instrumentalist approach to girls' education also risks overlooking a rights-based approach to girls' and women's sexual and reproductive health. Research has shown us that an empowering education that promotes girls' reproductive rights and attends to issues of gender and power is a more important determinant of girls' reproductive health outcomes than the number of years she's in school. So without attending to the quality of her education, she could be sitting in school for 12 years learning that her role in society is to join the marriage market rather than the labor market, or that her value in society is determined by the number of sons she bears, for example, rather than by the number of ideas and innovations she might create. So a focus on girls' education for its impact on fertility, we have to recognize that places the onus of reducing carbon emissions on women's wombs, and especially women in low and middle income countries, while ignoring other population factors and patterns of emissions that are especially present in high and upper middle income countries that have a greater impact on the environment. So this particular platform, if more attention is placed on girls' education and family planning, that approach must be grounded in a rights-based framework aimed at achieving girls' empowerment, gender equality, and climate justice. Reduced population is a positive but secondary outcome of all of this. So the second platform out of three is grounded on the role that quality education plays in fostering girls' leadership and women's capacity to participate in climate decision-making. So this platform is grounded on research that shows a clear linkage between women's leadership and pro-environmental outcomes, including the ratification of environmental treaties like the Paris Agreement and the passage of stricter and bolder climate change laws, policies, and institutions, all of which is highly associated with lower country carbon footprints over the long term. So here is just an example of a snapshot of some findings from a study of 91 countries where researchers found a really strong relationship between female representation in parliament and a country's climate laws, institutions, and measures index, their climate score, which measures the boldness of climate change mitigation policies adopted by countries. So, the evidence is there that there is also a very powerful connection between girls' education and political empowerment and women's participation in politics and leadership. And then the third platform, quickly, is a focus on girls' education and the evidence that quality education can play a critical role in ensuring that girls develop key life skills to navigate the world. In our analysis of life skills, we are suggesting that the kinds of transferable skills targeted by girls' life skills programs overlap a great deal with the competencies, or what we call sort of the green skills, that are required for a just transition to a climate resilient green economy. And so these include skills like systems thinking, futures thinking, divergent thinking, critical thinking, and so on and so forth. So lots of different kinds of green skills here. So if we consider this, an investment in girls' education is critical to developing girls' green skills needed to participate in green sector jobs. So this is particularly important given the marginalization of women to the fringes of our present fossil fuel dependent economic systems. If green sector industries become the driving economic force that they have been projected to become, really centering girls and women in the transition will be vital to their inclusion in an alternative, regenerative, and more inclusive economic system. At present, industries like agriculture and tourism that have the greatest potential for environmental innovation are already key to the world's poor and to the majority of women in these sectors. And current estimates suggest that such green sector jobs currently employ millions of people and that these jobs will continue to grow. But at the same time, current discussions about a just transition are heavily focused on energy, transportation, and infrastructure sectors that really rely more heavily on STEM skills as they undergo green innovation. But The problem is at the present, women occupy less than a quarter of jobs in the clean energy sector, for example, and the STEM fields are heavily underrepresented as well in terms of STEM fields of study. Another issue is that present discussions of green jobs fails to include critical sectors like healthcare and education, which are vital to ensuring society has the capacity to adapt to climate change, to bounce back from weather-related disasters that are exacerbated by climate change, and to really kind of help us enter into that social transformation around mindsets and behaviors. So an investment in girls' green skills development will really help to ensure that women aren't left behind to occupy undervalued spaces at the margins of a green economy, as they have been in our present fossil fuel-driven economy. So when we think about girls' education in the context of climate change, the theory of change of this particular platform rests on the notion that a quality transformative education can really help provide girls with the necessary skills to not only adapt to a changing world impacted by climate change, but also a changing world of work. And in this case, one that is intended to be greener. So to recap, investing in girls' education is a foundational strategy for addressing the underlying gender inequalities that drive the unequal impacts of the climate crisis, as well as some of the unsustainable social systems fueling climate vulnerability for girls and women. And in fact, climate researchers have modeled different development scenarios and their impact on our ability to keep global warming levels within the 1.5 degrees Celsius target. And they found that social justice and gender equity are key requirements for human society to be able to keep warming within 1.5 degrees. And based on the research that I just synthesized here, we know that there are 3 ways that we can focus our investments in girls' education as a climate solution, and that's to promote girls' reproductive rights and to ensure equitable climate action, to invest in girls' education to foster climate participation and climate leadership, and finally to develop girls' life skills for a green economy. So that is it from me. I'm gonna just stop my screen share. If I could figure out where my screen share is. Am I still starting?
Yep, you're good.
Okay, I'm good. Okay,
Great. Thank you so much, Christina. That was fabulous. And I think really it's setting the stage really nicely for the next 2 speakers here. And just a reminder for folks, if you have questions or comments for our speakers, to please put them in the chat. And so our next speaker is Mande Limbu. She's the Director of Global Initiatives at FP 2030. She oversees and coordinates FP 2030's engagement across critical areas, including partner relations, global advocacy, rights and empowerment, emergency preparedness and response, and adolescent and youth issues. Mande is a policy and advocacy professional with over 10 years experience shaping policy agendas and advocacy strategies to improve reproductive and maternal health. Her expertise lies in successfully leading national and global advocacy campaigns to influence prioritization and financing of family planning and maternal and child health programs. She's previously worked as a senior manager for advocacy and civil society engagement at FP 2020 in Washington, D.C., senior advisor for global policy and advocacy at White Ribbon Alliance in Washington, D.C., and director of sexual, reproductive, and maternal health at CARE Tanzania. She holds a JSD from Cornell and LLM from Georgetown. Originally from Tanzania, Mande is fluent in Swahili and English. So welcome.
Thank you so much, Katie, for that introduction. And thanks again for inviting Katie and I to this very important conversation. So for those not familiar with FP 2030, we are a global partnership of government, civil society, multilateral organizations, donors, private sector, which was founded in 2012 with an ambitious goal to enable 120 million additional girls and women to access and use modern contraception by 2020. And we did focus on 69 countries. So FP 2020, as it was known then, back in 2012, was launched at the moment when global attention to family planning was at a low point. The idea behind FP 2020 was to jumpstart progress, bringing all family planning stakeholders together, donors, civil society, governments to break through kind of long-standing barriers in the field and generate new momentum for family planning. So although the time frame was short, 8 years from 2012 to 2020, the partnership made significant progress, especially in the areas of data, in terms of how data is collected, analyzed, and used by countries strategically for decision-making and for measuring progress against country commitments and priorities. Also, a lot of progress in expanding the method mix, strengthening supply chains, improving service delivery, and reaching adolescents and youth, as well as a lot of success in terms of partnership building, movement building, advocacy coordination, both at the global and country level. So I would really encourage you to read our 2020 progress report on our website, and my colleague Kate can put the link in the chat box for more information. So we are currently in a transition since we are in 2021 now. So in January of this year, we officially took the next step in our formal transition to the next phase of the Global Family Planning Partnership, launching our kind of new journey as FP 2030, more energized to expand the FP movement and galvanize greater commitments to support the rights of women and girls who wish to use contraception. We are a commitments-based partnership, and by commitments, I mean a public written commitment made by a government or other stakeholder to take specific, measurable, time-bound steps to advance family planning. So this is still commitments are central to our work. And in this transition year, we're focusing on mobilizing new commitments to the partnership from governments in Africa and Asia, where we already have relationships, as well as in the LAC region, where we're seeking to build new relationships and secure commitments from new countries and new stakeholders. I also just wanted to mention that one of the focus areas in our new vision framework is around transforming social and gender norms. And one of our priorities also is to cultivate new multi-sectoral partnerships, including with climate change and environmental justice partners, as well as strengthening integration of family planning with other health sectors, including HIV, maternal and child health, nutrition, which also means we'll need to strengthen our partnerships with professional associations such as ICM, ICN, FIGO, and others. So I'm saying all this because I think there are definitely some synergies and potential areas for collaboration with your movement and your community. So that's just a general overview of FP 2020, and I will hand over to my colleague Kate Lane to talk more about our adolescents and youth work, sort of like from a gender equity lens. So I guess over to you, Katie, to introduce Kate. Thank you so much.
That was an excellent overview. And I've got so many ideas now. Like, I know that a lot of our nurses will be very excited to think about ways that they can partner with the work that you're doing. This is really exciting. So our third speaker is Kate Lane, who is the Director of Adolescents and Youth at FP 2030, where she oversees their partnership to meet sexual and reproductive health and rights needs of adolescents and youth, and to advance partnership approaches with youth leaders and youth-led organizations. Kate has over 30 years of experience in adolescent sexual and reproductive health, and has worked on both the implementation and donor side, including Pathfinder International, the Futures Group International, Advocates for Youth, and USAID. Kate has worked in a number of low and middle income countries in sub-Saharan Africa and South Asia, and she holds a master's in public health with a focus on health behavior and education and population planning. And we're so excited to have her here with us today. Let me just pull up presentation here.
Thanks, Katie. So just in prefacing this presentation, you know, the adolescent reproductive health has been on the global agenda for about 25 years, but we've not really been able to make a whole lot of progress considering how much attention and resources have been thrown at it. And the Lancet has a standing commission on adolescent health, and they have pointed out that in the past 25 years, we've seen some real dramatic improvements in under 5 morbidity and mortality, and we've seen dramatic drops in maternal mortality, but adolescent health hasn't really seen the same sorts of changes and improvements as children and as women. And as we do a better job of ensuring young children survive past their 5th birthday, that means eventually they're going to be transitioning into adolescence. And if we're not paying attention to adolescence, we will lose that opportunity to sustain those gains. And in fact, when young women do begin to access health services for the first time, it's often in relation to an unintended pregnancy or concern about being pregnant. It's a persistent problem. I mean, we've seen drops in adolescent fertility around the world, but for many, many years, the United States had the highest level of adolescent fertility in the developed world, US and the UK. And because we've given our kids mixed messages, we've not been able to implement comprehensive sexuality in schools very well. The services, there's been a lot of swirl around the access to services. I'm sure many of you remember the conversation back under the Obama administration about making emergency contraception more accessible to young people. And one of the things we find with young people around the world is a lot of their sexual activity isn't necessarily consensual. There's a sort of persistent notion that young people are just out there having a good time, right? And we find that in many countries, their young people's sexual activity is coerced or it's forced. It's not consensual, or it's because they're poor and it's a means of securing income to do things like stay in school. So I think we need to begin to do more to think about some of these underlying factors that drive poor adolescent health outcomes, and going beyond just providing them with information, access to services, looking at the sociocultural norms around things like early marriage, around gender equity, where young women do not have much of a say, where in many countries, women are expected to be passive, men are expected to be the sexual aggressors. And I think this really has a lot to do with the fact that we've not been able to see these kind of reductions in adolescent fertility that we'd like to. And of course, when girls do get pregnant, it derails their aspirations. They're not able to complete their education. They're not able to get the jobs that they might want. And they're often end up in early marriage where maybe they would have had 4 kids if they've been able to delay that pregnancy, that sexual activity, and in the end up having 6 or 7, which then of course contributes to all the negative outcomes that we're talking about here. So we are working with the countries that contribute or make commitments to FP 2030. We're really trying to shift the dynamic, shift the narrative around how countries address the sexual and reproductive health of adolescents. And we are going all out and working with countries to really be bold and transformative in the way that they make commitments to change the sexual and reproductive health outcomes of young people. Next slide. So we think that commitments can do a few things. One is they can begin to help countries acknowledge that in many places around the world, even though the proportion of adolescents in the population is starting to decline somewhat, we're still seeing an actual absolute number increase in the number of young people. So we expect over the next 30 years that we'll see an additional 50 million or so adolescents added to the population. We also feel that it's time we work with countries to go beyond boutique pilot projects, a little youth-friendly service here or a little effort over here, but we need to start working with health systems to become more responsive to adolescents and youth. One of the popular approaches in many countries is to set up what they call youth corners, which is not very well defined. They're often not staffed. They're often more intended as places where young people can come in and get information, because there's this persistent belief that if we just tell young people about the dangers of sexual activity and the fact that it's going to ruin their lives, that young people will just go, oh gosh, I never realized. And you're right, I will abstain until I'm married and problem solved. We also know that young people access other services in the health system besides just sexual and reproductive health. So if we can do a better job of making overall health services, inclusive of maternal child health services, more responsive to young people, versus these sort of standalone activities that are difficult to sustain, we might actually begin to see some significant changes in adolescent health. And then that leads to the third point, was we need to do a much better job in many countries. And I think the US I think we're on this trajectory, but in many countries, we're far, far from any sort of institutionalization of adolescent-friendly services and implementing at scale. And I can't think of a country in lower middle income countries where they have done a really good job of implementing services for young people at scale. Next. So our thinking is that there's a couple of things that commitments should try to address to really shape the narrative and the dialogue in the countries where we're working. One is obviously we need to improve young people's knowledge of sexual and reproductive health, how to prevent pregnancy, how to prevent HIV, learning about contraception, agency, all these things that contribute to young people's ability to make good choices and decisions. But unfortunately, many countries stop at the knowledge piece. And as I said earlier, I think there's this persistent belief if we just scare the hell out of kids, they'll stop doing naughty things and just behave themselves. And that's just really not the case. Developing AOI agency and skills, and I think Christina referenced this in terms of green skills. I think we talk about these skills, green skills, life skills, soft skills, but it's really helping young people begin to internalize information and learn how to apply these skills. And when I was in grad school many, many years ago, we talked a lot about self-efficacy. So how do we help young people take that knowledge and operationalize it into their behaviors? And then of course, we want them to be able to make use of services that are available while also making sure that the services that are available are responsive to, supportive of, non-stigmatizing, non-discriminatory, and allow young people to make the kind of choices and decisions that we know are healthy for them. Next. So there's a few things that we have recommended to the countries in terms of making their commitment to young people. We've laid out several strategies that we are encouraging countries to take when they are developing their commitment. One is that the World Health Organization has done a tremendous amount of work to establish standards and criteria for what makes a service adolescent responsive. And so these are things that countries can begin to take and begin to adapt in their own countries, and really trying to make adolescent services institutionalized and driven by quality standards. The next is partnership with young people. And over the years, there's been a lot of dialogue around what people call meaningful youth engagement, which has been implemented well in some places, not so well in others. But meaningful youth engagement still implies young people are kind of beneficiaries. There's a power imbalance. There's not a lot of equity there. So can we do more to help countries see young people not just as beneficiaries, but as partners in this effort? And one of the things that's happened over the past 25 years is because of pushes to get girls in education, young people are better educated. And also because of things like social media, young people are more exposed to different ideas, different ways of thinking. So, you know, these aren't the young people that we were working with 25 years ago. These are young people, they're standing up and saying, we have a right and we want to be involved. We are a bit challenged around adequate data around adolescent health. Some of the data that we have is, it's hard to get age disaggregated data out of the DHS surveys. It's hard to get age disaggregated data out of health management information services. But we need to do as much as we can with the data that we have and begin to cross-reference with data from other sectors like education, because we know education is a driver of poor adolescent reproductive health outcomes. So if girls are dropping out of school and getting married, that implies that early pregnancy is going to be an issue. So how do we cross-reference some of that health data and use with other sectors and use that data to inform the types of programming that countries should commit to? We also want to get beyond this notion of it's just about, you know, knowledge, attitudes, and practices and the supply-demand paradigm, but how do we begin to understand these kind of socio-cultural gender norms that influence young people's behavior, like early marriage or gender inequity, or not allowing not providing space for young people to speak up and share their ideas and their perspectives. We know that with 1.9 billion young people, there's a lot of diversity in young people. They're married, unmarried, in school, out of school, rural, urban, different ethnicities, disabled, LGBTQ. There's a lot of diversity, yet the response from a lot of countries is sort of a one-size-fits-all approach. So we need to help countries understand how to sort of map out and disaggregate youth populations and figure out how to match the right interventions to the right young people and the right vulnerabilities. And then we can do a better job of articulating and implementing partnerships across sectors And the Lancet Commission has pointed out that a lot of the vulnerabilities that young people face are outside of the health sector. And so the solutions to adolescent pregnancy can't only rest within the health sector. So we do need to partner with education. We do need to partner with employment. We do need to partner with justice, all these different factors that play into young people's abilities to make good decisions. And so here on the other side are some great resources that have been developed around over the years. One of this thinking outside their separate space is a tool and resource that says, there's different models of providing services to young people. It doesn't have to be a youth corner. It doesn't have to be a separate space that's different time, different location, but these are resources that countries should be applying in the development of their programs. And next. So the 3 key steps that we are asking countries to take, sort of in summary, is 1, doing a better job of partnering with young people, being intentional about it, providing space for young people, making sure that young people sit on technical decision-making groups. In many countries, there's family planning technical working groups that advise the government about their family planning strategy. So let's make sure that young people are sitting on those technical advisory groups, and in a way that recognizes and celebrates their contributions and their expertise, not as note takers or as quiet little folks sitting in the back of the room, but having a voice and having a say and having influence. Again, making sure that we're using the data that's available to us and going beyond just the DHS surveys to look at a range of census data, HMIS data, other surveys that are other population-based surveys, research that's being done, and look at that data within the socio-cultural context of countries. And what works in one country is not necessarily going to work in another. And then finally, I think the biggest challenge that we face is we really have identified the what. The how is the piece that we struggle with. And we've got lots of pilot programs and boutique programs. Again, we've not really been able to implement much at scale, but in part it's because we're not always matching the evidence-informed intervention to the young people, the needs of the young people. So for example, many of the commitments that were made about 5 years ago to FP 2020 were very focused on comprehensive sexuality education. Well, that's a great intervention if, number one, you can do it right, because a lot of comprehensive sexuality education is how well you do it, not just the availability of comprehensive sexuality education. But if the majority of your children or your young people are not in school, then how is comprehensive sexuality education going to be the best intervention? Maybe you need to be looking at things like, preventing early marriage. We had one country that submitted a commitment that wanted to do a lot of work at the university level. But when you go back and look at the data in that particular country, you see that 75% of women are married before the age of 18. So is a university-based program that distributes contraceptives in university health centers really the type of approach that's going to get us to improve contraceptive use and shifting gender norms, et cetera, et cetera. So how can we do a better job of lining up the interventions with the actual needs of young people? And that might be it. I'm not sure. Is there one more slide? Oh, okay. Sorry. And then again, talking about this issue of the enabling environment. And again, so much of our work is focused on making sure that the supply of services and contraception is there and that we're generating demand among young people. But we know a lot of young people would like to use services, but they don't feel empowered to use services because the sociocultural environment doesn't necessarily reinforce their ability. I've talked to young people in a number of countries that are like, yeah, I know that the nurse in that health facility is nice. She comes to my school. She's really friendly, but the idea of walking past my community to be seen going into a facility that's family planning clinic day, I just can't do it. I can't do it. I will go to the next town over before I go to my local facility, because they just can't deal with the social blowback of somebody being like, I saw you going to the family planning clinic. Does your mother know? All these sort of things. So if we're looking at making sure that an enabling environment is a supportive one, we have to talk to young people and elicit what the challenges that they face are in this sort of enabling environment. So we need to look at things like, how well are we engaging young people? Are we engaging them in a way that's equitable, transparent, and honest? Or are we doing it in a tokenistic way so we can pat ourselves on the back and say, well, we engage those young people. What's the problem? Many countries pass great policies but the policies sit at the national level and collect dust. They're never resourced, they're never rolled out to the state or the district level. So how can we do a better job of taking some of these really nicely done policies and making sure that they're being applied and resourced at the district and facility level? Again, looking at the effect of sociocultural and gender norms on the choices that are available to young women, this issue of collaboration and coordination with other sectors, especially education, and then also beginning to look specifically at the highly vulnerable young people. Those would be young people that are displaced by humanitarian crisis. There's more and more interest in looking at disability, adolescents living with disability. In many countries, this is still quite common, that there are a lot of young people that are living with disabilities and they are hidden away, or they're just sort of not acknowledged to be sexual beings, and yet they're often quite vulnerable to abuse because they're dependent on adults and others for their support, and they are kind of, what's the word I'm looking for? They're kind of programmed to be receptive to this type of support, which can sometimes verge into abuse. And then just young people that are in crisis for whatever reasons. And that might be the last one. And that was the last one. So thank you so much. We're really hopeful that we're going to see some strong commitments. I know it's baby steps. If we can get a few more commitments in the next year that go beyond comprehensive sex ed, I will dance a jig. So we'll see. We're waiting to see, as those commitments come in, how well we've been able to sort of shift some of the thinking at the country level around the importance of adolescent health. Thanks.
Thank you, Kate. That was great. And again, very inspiring. I'm like, oh, there's so many opportunities.
There are a lot of opportunities. Yeah.
And I was just thinking of, one of the things in the environmental health space that, we hear from a lot of communities, especially environmental justice communities, is how health groups or environmental groups, they kind of come in and they have all these ideas, but then don't ask the community what their needs are. And I feel like with adolescents and young adults, they have the same thing here with family planning. It's like you get these folks that are like, well, here's our ideas. And, it may not be what they're looking for.
That's often the case, is they'll come to young people with an idea and then basically ask them to endorse the idea. And young people are, in many countries, they're supposed to respect their elders. So they're not necessarily going to push back and go, no, that's not what we want. They'll just kind of agree. But then they won't use the services, because, and I've had this experience personally where we go in and we're like, we're going to do this and this and this. They're like, oh, great. And then 6 months later, you go back and they're like, so you guys actually do this? They're like, yeah, no, doesn't really.
Great. And just a reminder to folks, if you have any questions, to put them in the chat. We have a couple comments and questions. Kathy, this is, said this for Christina. She said, I'm so glad you addressed the tension between carbon drawdown strategies and the racist colonial history on BIPOC women. So I think that really resonated with folks. And this question could be for any of our speakers. Amy has asked, how has COVID-19 impacted funding for gender equity, education, sexual reproductive health internationally, and how do we regain any lost ground or momentum?
I think Monday's really well positioned.
Yeah, I mean, I can start. So really, the pandemic has, as far as I'm concerned, like threatened decades of hard work as far as access to family planning and sexual reproductive health. We know from UNFPA that women, about 1.4 unintended pregnancy, supply chains disruptions, just overstretched health systems. We've seen spikes in teen pregnancies, gender-based violence, and so on and so forth. So we really continue to advocate for sustained investments because in many countries, family planning, SRHR was not put in guidelines for response, when they're starting to shift funding to COVID response, the kind of SRHR is one of the first to go. So really working with our country partners and advocates and governments to ensure that the investments and that family planning, sexual reproductive health is considered essential health service in their response approaches, and just working with a lot of implementing partners as well who work in a number of countries to make sure that service provision, coming up with innovative ways to make sure that service provision continues through community health workers and other approaches. And now we're also supporting our advocacy partners in many countries in terms of ensuring equitable distribution of vaccines. So yeah, I will just let others add to.
Yeah, I dropped into the chat box as well a document that we created last year with the International Association of Adolescent Health, because we were quite worried that adolescents were going to get quite overlooked in the pandemic, which they were. So, you know, in fact, for example, we were saying one of the things that we needed to make available to young people was easy access to contraception over the counter, which was inclusive of emergency, given that in the Ebola epidemics in a few years back in Africa, one of the things you saw in Liberia and Sierra Leone was a huge uptick in early pregnancy because girls were engaging in transactional sex or forced sex. And so if girls had better access to emergency contraception, you know, because they're obviously not negotiating contraceptive use when you're being raped. So if they had you know, you could have prevented some of these early pregnancies, but there's still a lot of anxiety and discomfort around making EC more available to adolescents, perspectives that it's going to be misused and irresponsibly used.
I think an additional challenge is that as countries begin to really respond to the economic shock of the COVID pandemic, that you're going to see huge decreases in budgets to things like adolescent reproductive health, girls' education. Already the UK, for example, has slashed their foreign aid budget, and there's estimates that's like up to 40% less in terms of, you know, of the funding that will be available. And that's huge. And that's like thinking of hundreds of thousands, if not millions of young girls and women being affected by that cut. Yeah. So it's the sort of COVID response is a big.
And a number of countries reported, you know, upticks in early marriage as well, because if the girls weren't in school, parents just don't want them at home, because again, there's always these anxieties around girls getting extramarital sexual activity and extramarital pregnancy. So the response is to get these girls married as soon as possible.
One of the questions in the chat is, I think both for educational programs and family planning programs, if you have any examples of programs that have been successful or are, you know, launching that you think have real potential to do a lot of good.
So there's one program that's been supported by the Gates Institute called the Challenge Initiative, and this is it's funded by the Gates Foundation. They've been doing a lot of work in urban cities, I mean, like big mega cities in a number of countries. And the Challenge Initiative has tried to apply what they call a whole of clinic approach to young people. And I was saying earlier that, you know, you might have a particular provider in a facility, but there's a lot of steps to go through to find that provider. And it starts from the security guard at the front door, the cleaner, the register. So they've been trying to see how they can make the entire facility youth friendly so that every step of the way is a positive experience, because it doesn't take much to derail a young person's intent to seek services. If they get way too much disapproval, then they'll just turn around and head right back out again. So I think that's the Challenge Initiative. I'll see if I can find the link. But that's one that I'm really intrigued by.
I think CAMFED, which is the Campaign for Female Education, is a really great organization that's showing how addressing not only girls' education, but also sexual reproductive health and rights, and also green skills is vital to lifting sort of the social status and prestige of young women and their own self-respect and confidence when it comes to engaging in, for example, agricultural entrepreneurship, climate smart agriculture, that addresses sort of the climate vulnerabilities that their communities face as sort of agricultural communities. And then also, provides them with the knowledge and the skills to act on that knowledge to really pursue their educational endeavors and their business endeavors, and just they're doing a really great job kind of showcasing this, and have won some really great awards for their work, and really showing how a comprehensive and holistic approach to girls' education and sexual reproductive health and rights is so key to addressing all these various factors that increase their vulnerability and marginalization. So I think ChemFed's a really great one.
I would just add the Momentum project, with USAID, JPIGO and others, as well, as far as integration of services. I think that's really key, as Kate was mentioning earlier, or I think it was Christina, maybe, in terms of the way we approach healthcare, and the fact that, I had a colleague who used to say that we tend to separate the uterus from the womb. I mean, it's all one, and women and girls, and the services are not supposed to be that siloed. So I really appreciate that they're really trying to make sure that in the programs that they have in many countries, that they really strengthen integration of services.
There's also a project that USAID's been supporting for about 10 years now called Youth Power. And I was at AID for about 6 years and was involved in the development of that project, but it's all about trying to apply positive youth development approaches and working across sectors. And it's become quite, I understand from talking to my colleagues at USAID loves it. So we've been trying to make the case to USAID for years that, again, it's not just about youth-friendly services and access to contraception, but things like keeping girls in school and employment options and life skills, and all these things are incredibly important measures and aspects to develop, in addition to educating them about contraception and making contraceptive services available.
Great. Well, we are at the top of the hour, and this was such a great panel. I just wanted to thank the three of you so much for joining us here today. I know everyone has been really inspired, and lots of great questions. And just to remind folks that we have 1 hour of free CE for today's presentations, and you'll be getting an email from us with a copy of the recording, as well as a link to take the post-test and evaluation if you'd like to get 1 hour of free CE. And it usually takes a couple days to get that out. So don't be nervous if you don't get something today. So have a wonderful day, everyone. And I thank you again to our speakers. This was fabulous.
Thank you.
Thanks for having us.
Thank you.
Bye,
Bye.
everybody.
Bye.